Welcome again. I'm Dr. Filiberto Rodriguez, board certified cosmetic surgeon, and this is Laura Navarro, our LVN nurse injector in our very busy med spa. What we want to talk to you together about is Laura's journey and how we were finally able to help correct all the bad surgery, and maybe it would help them understand what your position was back in the day and how you were seduced or convinced to let this unqualified surgeon, do this big surgery on you that ended up changing your whole life, causing you to suffer a lot.
Right. So nowadays I just try to be an advocate for women and men as well, but mostly women who are considering for their first time surgery, or they had bad surgery like me and they don't really know how to fix it or deal with it, because that was me. Even though I've worked in this line of aesthetics and cosmetic surgery for years, I never really thought that there was a way to fix me until I started working here with Dr. Rodriguez. And I was in a lot of pain because prior to the surgery that I had to have 2 emergency surgeries after the first one. I was sick. I didn't know what was going on with my body. And after the last surgery, it was basically, if you don't get better, you're gonna have to be admitted into the hospital, because they thought I was gonna become septic. And things went well after the 3rd surgery, or as well as they could go, that I didn't have to go to the hospital, but I did have 8 months of wound care when I never ever took an antibiotic in my whole life. I was going and getting IV antibiotics. I was on 2 different antibiotics orally, and I would go and get antibiotics IM for about 3 months in a row. So my immune system was super weak. Everything I ate or anything would break me out in a rash. I always felt tired. I felt sloppy. And with the wound care, mentally, my confidence was very, very low. I didn't feel normal, and I didn't feel beautiful, it was a disappointment to see myself every day thinking like I went somewhere to feel better and more confident about myself, to where I couldn't even look at myself in the mirror. And after the 8 months of wound care, I had a small daughter. She was 2. I wasn't able to carry her because I had open wounds on my breast. I wasn't able to take a regular shower because of the wounds. I had to go weekly to get the dressings changed. It became weekly, but before it was like once every 2 or 3 days. I couldn't get in the water. I couldn't go to the beach with my kids. I couldn't do a lot of things that I took for granted, that we could just get up and go. So I think that a lot of people take cosmetic surgery, or, oh, I want to get my breast done, or lipo, and they think that it's something not so serious until something serious happens, and then your whole world is changed.
That's the really good way of putting it. And an important thing to say, because I tell my patients the same thing. I mean, I'm not God.
Right.
Complications can happen. But there's a difference if you're with a surgeon who knows what they're doing and a small complication occurs, like a little wound complication. It usually heals by itself in a couple weeks. But this kind of suffering and 3 operations, and the sad thing is you trusted your boss, right? Mm-hmm. And you knew your boss wasn't a cosmetic surgeon, but you trusted that the person she would have you operating on would at least know what he was doing.
Right.
You just trusted a lot.
I trusted.
You didn't look online and say, hey, who is this guy? Let me see his before and after pictures. And that's, I think, how a lot of patients do get hurt, mm-hmm. is they have this inherent trust that, oh my God, this is a doctor.
Right.
He has a white coat. He must know what he's doing, and then they get hurt.
Right.
And that's why we want to get the message out that please do your homework. Your body's not an experiment.
It's not an experiment. I wish I would have known what I know now, which is why I'm not shy anymore to talk about what I went through, because in the beginning it was embarrassing. But I realized that if I could save somebody from doing the mistake that I did, it would be worth it. So.
Or even some of your patients who need to get repaired and they don't know who to go to.
Right.
And you can be like, well, hey, right here.
Right.
You know, it's not to put her on the spot, but she does often get asked to show off her body, and patients are shocked with the beauty of her scars and everything.
I'm shocked. No, I knew what to expect, but at that moment, I was in a lot of pain. I couldn't even lift my arm up. I couldn't sleep.
Yeah.
To my back, to my side. I was miserable. And so I'm more than happy to talk about it now, because I didn't know. I thought I was going to have to be like that forever. And I thought that's what I get for not doing my homework or not looking into something more, or, you know, not taking my body serious. I would say do your homework, and pay attention to the consultation, trust your gut. Even though I work here, when I told doctor about my issue, he was like, go check in like any other patient, fill out the paperwork. And I had already been working in the office for a year, so I appreciated that experience because I can actually know what the patient goes through, and it was totally night and day from my previous consults. And I knew right away that he knew exactly what he was talking about because I met with the surgeon. And before, I didn't meet with the surgeon until later, and it was kind of like, this is what I'm gonna do for you. I never had any input. Granted, I had already gone through some complications, so I did have my questions ready for Doc, and he was great at answering them, and it wasn't uncomfortable for me at all. And I left there feeling super confident and excited about getting the results that I had wanted to get from the beginning. So don't do what I did.
The first time.
The first time. Do what I did the second time. No, just really do your homework and ask around and ask the doctor. Ask. It's your body. Ask to speak to the doctor, to the surgeon. If they just send you front desk, you know, ask to see where they're going to operate. Ask those questions before you go under and you have no voice to ask.
And that's what patients should do, is take their body seriously and realize that it's really not worth trying to save a couple dollars if you're going to end up with horrible scars or mutilated. I mean, you know, Laura shared she had 3 horrible operations to get her where she ended up with prolonged wound care that cost her over a year of her life. We had to do 3 operations on you to get you where you are today, but they were very pleasant operations, and we were doing very powerful interventions at each one. And unfortunately, your recovery was smooth.
The first thing that I could notice is I was in more pain before my surgery than I was after. So for me, that was a big sign, like something's going right. And as I was seeing the scarring, because I did ask the previous doctor, like, what's going on? And I was always told, it's your body. It's your body. I was fortunate to not have any stitches when I was growing up. So I just trusted him, and I thought, okay, well, why is my body not accepting this or that? But even after the wound care and I started to heal, my skin was so thin. I was so excited to take a shower, like a full shower, that even the water from the shower head was painful because the skin was so thin. So when I had my redo surgery with doctor, he said, take a shower. And I was so used to turning away from the water, and I thought, I'm gonna try it and see if it hurts me still. And all that thin skin was cut out, and it was beautiful, and I didn't feel any pain at all, which is why I said I was in more pain before my redo surgery than after.
Well, everyone, I hope you have had an opportunity to get a lot of information. This was a pretty long interview session. Again, just to sign off, I'm Dr. Filiberto Rodriguez, board-certified cosmetic surgeon, and this is Laura Navarro, LVN, our nurse injector. And we've been talking today about the importance of doing your homework before undergoing any kind of cosmetic procedure. Not just big surgeries, but even big injections. Everyone thinks, oh, it's just Botox. There's no such thing of just Botox. You know, anytime that you're having a needle put into your body or an operation, people should take it seriously. And thank you all for your attention today. And if you have any questions, don't ever hesitate to contact my office, set up a consultation, and we can go in more detail with your personal treatment plan.
Yes, anytime you guys are ready, Doc and I are here for you and the staff for anything that you need. It's better to ask questions than to not.